Hi class, I want to welcome you to Biology 2401. This first part will be on anatomical terminology. And the first thing I want you to see is this term anatomical position, which is where the subject stands erect, straight up, facing the observer, with their arms straight down at their sides and their feet forward toward the observer. And notice the palms are on the front, and we can see the person is looking forward. All of our descriptions in anatomy are going to be based on this model, even though patients usually are sitting or lying down. The first thing you're going to do is look at the body regions on page 2. And you'll notice in your lab manual, I've got mine here, you're going to see both an anterior, meaning front view, and posterior, meaning back view of the body. And when we are looking at these, you want to make sure you study over the parts and you know what a term means. For instance, if you look at the buccal region, that's going to be the cheek region, or the chin is the mental region, or your ear is the otic region. And you want to know the parts of the face, so you wouldn't just put face down if I asked you what region this is, or head. You would want to be more specific than that. So you're going to do that for the whole front or anterior, and then for the back. As a resource online, we have these torso models that are labeled. And you'll notice all of these terms you'll see in your lab manual, and a few more are on this model. So for instance, it's showing you the neck region is the cervical region, and the forehead is the frontal region, or the underarm, the axillary region, the breastbone, the sternal region, and the pectoral or the mammary region. So that's where we get the term pecs or pectoralis major muscle, because this is the pectoral region. The deltoid region, and the very top part of your shoulder, you'll feel a bump if you feel on the top of your shoulder, that's your acromial region. And when we get to bones, that same term, acromial, will be used. Here is your abdominal region, and your umbilical or your belly button region, your umbilical region where your umbilical cord was attached. And then the inguinal region where the thigh meets the trunk, and the pubic region where the external genitalia are found. Here's the back of the body where you can see the back of the head, the occipital region, and the cervical region, scapular region where your scapula, that's your shoulder blades here on the back, and then your hip is your coxal region. There's also a sacral region where a bone called the sacrum is found, and then also the gluteal region or the buttocks region. The mouth is the oral region. I already mentioned chin or mental, and otic or ear. The orbital region is the eye. And the frontal region, the forehead. The nasal region, the nose. And again, the buccal region, which is your cheek. We also see the fingers, which are the digital region. And the thumb, which is on another one, is going to be the pollex region. Here's the wrist, which is carpal. The carpals are the bones in the wrist. And then we have a antebrachial, the forearm, and a brachial region. Between these two, where your elbow bends, is your antecubital region. And then here is your underarm again, the axillary region. Here is the cubital or the olecramal region, and you might as well learn olecramal here because you're going to learn that term when we get to a part of the ulna called the olecranon, your elbow. Here's the hip again, the coxal region. The thigh is the femoral region. The patellar region is the kneecap. The crural region is the leg. But we can see on the side here, this is the lateral side or the outside of the leg. We call that the fibular region, and that's where the bone called the fibula is located. Here's the Here's the tarsal region or the ankle. And then the top part of the foot is the metatarsal region, the digital region, just like the fingers, and the big toe is called the hallux region. We can also see the sural region, which is your calf, and the calcaneal, the heel. The bottom of the foot is called the plantar region, and the back of the knee, the popliteal region. So the anterior, or what we call the ventral or the belly side region, you want to be as specific as possible in your answers on quizzes. So for instance, instead of just saying manus for hand, if it was pointing to the finger, you would want to put digital. So be as specific as you can when you're answering your questions for your quizzes and for your practical. So you have both anterior and posterior regions, and you want to look through a few of them I didn't go over yet, but you want to go ahead and start studying this so you understand it. The next thing you want to do is activity 2, and you'll find activity 2 on page 4 of your lab manual. And so we can see here a woman walking a dog, and we're just really going to be looking at the human aspect of these directional terms. The directional terms we want to look at are superior, which means above, inferior, meaning below, anterior, meaning toward the front of, and posterior, toward the back of, medial, toward the midline of the body, and lateral, away from the midline, so the shoulders would be lateral, dorsal, backside, so that would be the same as posterior in the human, and ventral, belly side, which would be the same as anterior in a human, proximal, meaning toward the attachment. So if we're looking at the arm, it's attached here at the shoulder. So if it's toward the attachment, it's going to be more proximal on the upper extremity. So that's even more proximal than the brachial region is, which is more proximal than the antecubital region. So as you go away from your shoulder to the tips of your fingers, that's going to be the most distal part of your upper extremity, which means away from the attachment. So really we're comparing two regions. So we would say the shoulder is the most proximal part of the upper extremity, and the fingertips are the most distal or distant part of the upper extremity. So we're going to use proximal and distal when we're referring to the upper and lower extremities. Superficial, toward the surface, and deep, away from the surface. So it gives you some more examples of these here, and in your lab manual it also gives you examples. So I want you to do activity number 2 in your lab manual, practicing using the correct anatomical terminology. And you can look at other pictures showing you these directional terms you want to know. The next thing I want to go over with you are planes. And planes are flat surfaces that result because of cuts made or sections made. So the first one here is the frontal plane. A frontal plane separates anterior from posterior. In other words, if we were going to make a frontal plane, we would separate, it would be a plane through the head that would separate the front part of the head from the back. And we can do this through any body part, and usually it's a computer that's actually making these cuts. So a frontal plane through the head would look something like this, where we can see the brain, and here's the skull, and this is showing the eyes and the tongue. So that is a frontal or coronal section. Another plane you want to know is mid-sagittal, and this is separating left from right exactly down the middle. Parasagittal means you're separating left from right, but it's off center. And transverse sectionals, also called horizontal sections, are cross sections. A transverse plane is going to separate superior from inferior. So if we wanted to cut something through and separate the top from the bottom, that would be called a transverse plane. So if we look at this, we can see here the sagittal plane, the coronal plane, and then the cross-sectional one, which would be the transverse plane. And if it was through the head, like it's showing you here in the skull, then this is what it would look like. So we get three different views of the same organ. So if we look at this model, we can see a mid-sagittal plane, and I already mentioned a frontal plane. And here is showing a wall chart going through the neck. So we can see the neck muscles here, and there's the tongue. This is a vertebra, and there's the spinal cord. This section is a transverse section, which separates top from bottom. So it would be cut this way. You also want to know body cavities. Body cavities are found on page 7 of your lab manual. And as we look at the body cavities, there's going to be two major divisions of these body cavities. The first cavity I want you to know is the dorsal body cavity. It's made up of a cranial cavity containing the brain and a vertebral canal or vertebral cavity containing the spinal cord, which you see here in white. The ventral body cavity is comprised of the thoracic cavity above or superior to this muscle, the diaphragm, and the abdominopelvic cavity, which is inferior to the diaphragm, or in other words, below the diaphragm. If we look at the thoracic cavity, we want to be more specific than that. So if you look at where the organs are located, if we find the lungs, each lung is located within a pleural cavity, and the heart is located in the pericardial cavity. If we look at the abdominopelvic cavity, we can see both an abdominal cavity and a pelvic cavity. The pelvic cavity contains the urinary bladder, the very bottom part of the colon or large intestine. The internal reproductive organs are also found in the pelvic cavity. So here we see body cavities, both the dorsal body cavity and the ventral, and then we separate the ventral into thoracic, diaphragm, abdominopelvic. And then if we look at that thoracic cavity, we can see really it's made up of two pleural cavities and a pericardial cavity. You also want to know the serous membranes, and we're going to use the term pleura to mean the serous membrane that surrounds the lung and lines the cavity where the lung is found. Remember, that's called the pleural cavity. And we use the term pericardium to mean the serous membrane that is on the heart and lining the cavity where the heart's found. And since that's the pericardial cavity, we're going to use the term pericardium. And then this abdominopelvic cavity is sometimes referred to as the peritoneal cavity, and that's where this one comes from, peritoneum. Now, this term parietal is referring to lining a cavity. So if you took a drawer and you put paper in it to line that drawer, that's what we are referring to as the parietal layer. If the serous membrane is on the organ itself, it kind of makes it look shiny, that is going to be called the visceral pericardium, or the visceral pleura if it's on the lungs, or the visceral peritoneum if it's on the stomach. So these are going to be directly on the organs, and that's where the term visceral comes from. Viscera means organ. So if the membrane is on the organ, it's a visceral membrane, and then the second word is telling us where it's found. Visceral pleura for lung, on the lung, visceral pericardium for on the heart, and visceral peritoneum for an organ in the peritoneal cavity or the abdominopelvic cavity. So we can see here directly on the lung, visceral pleura, and here on the heart, visceral pericardium. This is pointing to a lining of the abdominopelvic cavity, so this would be parietal peritoneum. If you go to page 16 in your lab manual, you're going to see a table with all of the organ systems. And what we're going to do in this next section, Activity 5, is to memorize the main organs in each organ system. There's also a table you'll see here you can fill in. So you want to be able to match the organs with the organ system. So if we look on page 16 at the top, you're going to see the organ system that has skin and hair as its organs would be the integumentary system. And I'm giving you here the organs you want to be able to identify, but you also want to know which system each one is a part of. So make sure you know bones are part of the skeletal system, brain and spinal cord for the nervous system. As you get to each system, you're going to go into much more detail, but we're just trying to learn where these organs are found. If we go back to this picture, one of the things you'll notice here is you can see the lungs, and you can also see this structure here called the trachea. And it asks you in your lab manual to label the organs on page 23. So I want you to look, and I want you to see if you can find the trachea on that page. And you'll also see the diaphragm on that page, this muscular layer here. Here's the heart, and that's part of the cardiovascular system. You can also see in this picture the spleen and the pancreas, here yellow. Here are the two kidneys. And down here, the urinary bladder. If we look in this picture, we can see the stomach down here and the liver. And you can also see here the thyroid gland. So it's asking you for those. And here are the lungs. So you would say the heart is medial to the lungs because it's more toward the middle of the body or the midline of the body compared to the lungs. Here's another picture where you can find some of these organs. So you can see the liver here and the stomach. And you should know what system those both are a part of, along with the large intestine and the small intestine. So what system is it? You should have said digestive system for that one. Here's the thymus, and the thymus is important in both the lymphatic system as well as the endocrine system, which is a system of organs that produce hormones. Page 23 has a torso model you can label, but you also want to make sure, if I point to an organ, you can tell me what system it's a part of. Once you've reviewed over this information, you want to start looking at it in different ways to learn it. So one way you can learn the information is using Quizlet. Another way is using the quizzes, because you can take your quizzes unlimited amount of times and the highest grade counts. So you just want to start working on them. They're timed 30 seconds per question, just like your practical will be, your test. So we get you ready for your test, and it also tells you kind of how much do you know of this information. Start working, and if you have any questions, let me know.